it's very clear from the report. There's no reason to suspend our vaccination program, as first, the vaccine is not what caused the death of our healthcare worker, and second, as DOH and FDA has continued to emphasize, the benefits of vaccination continue to outweigh the risk of us getting COVID, particularly severe COVID-19.
We all know from our day-to-day census that there's an upsurge of COVID-19. We can identify them if they're symptomatic, but we do not know who are asymptomatic. So surrounding us, we may be infected by someone who is asymptomatic, not having any symptoms. So the patient might have been exposed to a individual that she had encountered, and then she might be incubating or having asymptomatic symptoms at the time that she was vaccinated. As seen in her health declaration form, she declared her comorbidities as hypertension, diabetes, and controlled bronchial asthma. Okay, she was on maintenance bronchial asthma. It was a long-acting beta 2 together with an inhaled steroid. So the symptoms are all controlled. And we know for a fact that there's a certain period of incubation through the days that followed. She developed the symptoms after vaccination. So as I've said, the vaccine does not have anything to do with the infection. The exposure would have is responsible for this. The COVID-19 virus could be responsible for all the symptoms and could have explained all the manifestations that the patient had.
From the start, we've always been saying that since we are using vaccines under emergency use authorization, talagang the big part of it is we have to have very good monitoring and surveillance. Now, we're happy that the reports are coming in and that the surveillance is working, but we just have to remind everybody, kasi ngayon, konti pa lang naman tayo, no? Health workers pa lang. Once we start the community-based vaccinations, it's going to be a lot more, and we'd like to ask all vaccine delivery personnel to please take it seriously. We need this information. We need to see if there's anything happening, and we have to refer it immediately to the proper NAFIC or NAFIC for assessment so that we can always quickly assess if there's anything that we have to calibrate. And of course, doon naman po sa mga nabakunahan, ang lagi lang nating paalala, kapag po kayo nabakunahan, hindi po yun magic na biglang hindi na po kayo pwedeng magkaroon ng COVID. It takes time. You have to give your body time to develop immunity and resistance against the COVID-19 virus after a vaccine is injected into your body. So kailangan po right after vaccination, ganun pa rin po ang pag-iingat dahil meron pa rin pong risk, especially the first few weeks after vaccination.